Hi everyone, it's Stephanie with the Patient Story, and I'm really excited to introduce our guest today. Sheree is here to share her story about Waldenstrom's, and Sheree, it's so great to have you with us.
Thank you for asking me. It's great to be here.
Wonderful. First, how are you doing? I guess I think people are always interested in knowing. I know it's been about a year. You celebrated your first year of remission, June 4th. So congratulations on that.
Thank you. Yeah. I just had another checkup a couple weeks ago, and they said my numbers look good for my
Woohoo.
protein levels. So happy about that.
That's incredible. That's
Can't
all
have
you
any
can really
complaint.
ask for.
Yeah.
Wonderful. So Sheree, I know you've got quite a story, so let's get right into it. I
Okay.
know you mentioned that it was around March 2012 when you started to feel some symptoms. Can you describe what was going on, and then what finally got you to go to the doctors, and what happened?
Okay. I don't know if you have like this intuition, like there's something wrong with your body, and I was just feeling really anemic and not myself. I did have a medical doctor appointment, and for some reason they decided to run blood work. And my primary care was so smart. He took a look at all my other records that were on file, and he said, I noticed that something was going on with your knee MRI. And I'm like, what? He said, yeah, it's like a hot spot in there, like there's something not right. He said, I'd like to run a blood panel on you because I'm concerned that maybe you have an autoimmune disease. And this is my primary care saying this. So they ran the blood test, and he said, yes, it appears that there's something serious going on with your blood, and I want you to go see a hematologist. So he recommended one, but I remembered that my cousin Dan worked at WashU in the BJC network, and I called him that night and I said, do you know any good hematologist? I already looked up on Google St. Louis's best hematologist. I said, do you know anyone in this office? And he said, no, but I have a friend who does, and I will have my secretary talk to her secretary. Fluke thing, Stephanie. The very next day at 10:30 in the morning, okay, the office of Elaine Majerus was calling me to schedule an appointment. And you can't even get in to see her because she rarely takes referrals. So when I got to her office, actually I had to call my husband at work, and I said, I need to pick you up from work because we're going now. So she said, how did you even get an appointment? And I said, well, my cousin Dan, who works in odontology, well, his secretary knows your secretary. She's like, oh, okay. So I immediately got an appointment.
Yeah.
They did a blood panel. She said she saw something in there that looked like my white blood cell count was off. So they did a body scan, and I was scheduled for a bone marrow biopsy, and it came back that I had Waldenstrom's.
Wow. Okay.
And that was June in 2012.
So March to April to May to June. So it was like 2 or 3 months. I mean, what you've described, it happened over a series of how long? I mean, you felt your first symptoms in March. When did you actually get into to see the doctor? Do you remember?
Well, I mean, I think it was June. I didn't, my primary was actually doing some tests probably like around the end of April, May. And then once I got the notice that he thought something was serious,
Right.
then that's when I called my cousin, and it was literally an overnight appointment. I
Wow,
mean,
that's
it was like
amazing.
from the time I called him,
Right.
the next morning they were calling me to come in. And
And
that
that
was it. Yeah.
That is, to your point, that is pretty atypical. Just so people who are watching know, if they haven't gone into the system yet, usually
Yeah,
takes some time.
yeah,
If it's a pressing issue, like with mine, which was really aggressive, sometimes the recommendation is to go to your local emergency department or the hospital that you want to get checked into, so that you
right.
get into the system right away. But
Yeah,
Sheree, I'm so glad you were seen right away. So you learned
yeah,
very quickly.
yeah.
What I have to check in with you at this point, mentally, what's going on for you and your husband? Because it went from your primary care saying, "Oh, well, something doesn't seem right," to all of a sudden, "Wait, go see a blood cancer specialist."
Right. Well, she said, to me in that meeting after I had my bone marrow, I had like a follow up. She said, "What we're going to do is monitor you right now. Your IgM protein levels are way out of whack." And at that point, I think it was somewhere in the like thousands or something. A normal person needs to be under 250 for that protein level. And she said, "We're going to monitor you. We're just going to keep watching you. And you get scans, you get blood work." And it went on like that up until 2018. And then my numbers started to spike. I looked at my chart um, once I got on the BJC network, and I noticed that in 2018, my IgM levels were going up to 3,000, which
Oh
is
my.
abnormal. Um, so she used the chemo word in the beginning of 2018. She said, "I'm thinking that, you know, we're probably going to need to do chemo this year." And she said that, and what I said to her was, "Okay, let's get this done. Let's do it." You know.
Yeah,
And my husband actually said that I was very like ready to go. You know.
calm, just ready to
Um,
move forward. But Sheree, I have to ask you, I mean, you're diagnosed in June of 2012, and then it's a lot of wait and watch monitoring. When you were diagnosed with Waldenstrom's that June, do you remember mentally what was going through your head? How they had described what kind of a cancer it is? Was that the first time you heard the word cancer? And
um,
yeah.
no, my father actually passed away from stomach and liver cancer. So, I mean, that was part of our life. And so I had been around friends with cancer as well. But my cousin Eugene had a non-Hodgkin's lymphoma. I'm not sure what the particular name was, but he lived with it all of his life, and he never had to have chemo. So I was hoping maybe I would be like him.
Right.
Um,
So what I'm
but
hearing is you were familiar with cancer with people in your life. It is different though, right? When you're diagnosed with the word. I'm just curious how you and even with your husband being, I think, your primary caregiver, what that emotionally, what that impact was at the time, or was it like, okay, well, this is more like we're just gonna see what happens.
well, for me, when I was told that I was going to be monitored, I wasn't too worried about it because it was just a monitoring phase. And my faith also helps me because I just try to turn it over to God. You know, it doesn't always, sometimes I forget not to turn it over to Him, and I try to take control of the situation, but that's not the best thing to do. So
Right, right.
it's easier when you just let it go.
Let it go. No, those are really, that's a great reminder, actually. Whether
Yeah,
someone is religious or has some faith, uh,
yeah,
that's very helpful. So you basically were monitored for 6 years,
right,
and you had quarterly checkups with blood tests, office visits. Sometimes you had CT scans.
right.
Before we go into that, can you describe? I mean, you went through so many scans. Can you describe the CT scan for people who haven't been through one? And you went through a lot of MRIs as well, so you could describe that as
Right.
future.
The CT scans are not scary. The very first one was just because you don't know what to expect. But basically, it's just this little, it's like a donut hole that they put you through, and you can see out to the other end. So even if you're claustrophobic, it's really not a big deal. Okay, the CT scans aren't. The MRI, on the other hand, I typically had to take a part of an Ativan to go do an MRI, because if I cannot see out the end of the MRI, or if my head is in the MRI, it's a little nerve-wracking, to be honest. But they only did scans from the chest down through the pelvis. So my head was typically, if I looked up, I could see the ceiling, and that was about the only thing was out was from my nose, my eyes, and my forehead were looking out of the MRI. But yeah, I mean, I did not like the MRIs at all.
Right. It's a tight space. It's you have to be still. Did you have, so were they looking for growths essentially? And I ask only because people talk about scanxiety, right? That you go take a scan and then there's some, anxiousness about the results, because usually the results take a day or two.
Right. They're always looking for cancer in your organs, in your lymph nodes. They need to check that to make sure that the blood cancer has not spread into your organs. So, which was the case in my father, because he had it in his liver and his stomach, and it was in his blood as well. And also, I think it metastasized in his brain, which I found out at a later date when I got a copy of his death certificate.
Wow.
So, yeah.
So for you, did you deal with scanxiety? Did you ever feel nerves, before seeing the results? And if so, what's your guidance to other people in terms of how to deal with it?
Well, I'll be honest with you. I've had about 13 surgeries in my life on other parts of my body. Organs, limbs, arms, neck. So I kind of have been used to being poked and prodded all of my life, and this was just another obstacle to get over. And when my doctor, the main thing that she said to me, which I took away, which was a good sign, she goes, "It's manageable and treatable. Waldenstrom's is manageable and treatable," and I could deal with that. I could live with that. So
Right.
those words were really important to me.
I'm so glad you heard them. Sometimes people don't get that sort of characterization.
Yeah.
But okay, that's wonderful. So, and by the way, you had mentioned you did undergo a bone marrow biopsy before
Yes.
the wait and watch. Do you remember what it was like? If you want to just sort of describe very quickly to people.
Oh, sure. Okay. I am not a person to take pain pills. I can't stand them. I can't stand it when, like, I was in the hospital for a liver surgery, and they tried to give me like Percocet, and it totally wigged me out. And I'm like an ibuprofen kind of gal or a Tylenol kind of gal. But I did get a little bit nervous before my first bone marrow biopsy. And I asked them if I could have an Ativan. And they said, "Well, we can't give you a pill form, but we can give you a sublingual form." So it's just this strip thing that you put in your mouth, and it dissolves like a pill, and it really makes you relax. I was laying face down, so I did not know what was happening. They numb the site where they go in, and it's basically like can I say what the instrument was like?
Yeah, of course.
It's kind of like I don't know, like a drill screw. Does that make sense?
Yeah.
And it's in a cylinder. So I did not ask to see this thing before I did my first bone marrow biopsy. I did not want to know. I was face down, and they were playing the jazz station. My husband was in the room with me. And then they would give me prompts they're like, "Okay, we're going to tap, 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 tap. Tell me if you feel any pain in your legs or any sensation." And they're like, "Okay, now you're going to feel a twisting." So they would tell me ahead of time what I'm going to feel, so I wasn't surprised by it. the whole area was numb. So I didn't feel anything except like weird sensation in my limbs. And then they would get to the point and they would say, okay, we're going to aspirate now, which meant they're taking the bone marrow. So they took the bone marrow out, and I asked to see it, which a lot of patients do not. But I'm like, wow, that looks really interesting. So it looked like this beautiful crimson white seahorse the first time it was taken out of my body. I'm like, wow, that's wild. And it's just like a tiny little, pardon me?
Did you say seahorse?
Yeah, the first time it looked like a seahorse, the way that they took it out of my body. And it was really beautiful. I mean, I'm looking at my bone marrow, you know. So I was just really kind of excited by the whole thing. And my husband took a picture for me so I could save it. And I still have that picture somewhere on my computer. But, and the whole procedure probably takes less than 15 minutes at the most, you know.
Right.
But,
bedside.
So I did not let that bother me. And then I had another bone marrow biopsy again before chemo, which was in 2018. And that was by the West County location. And when they did that one, it looked like a little beautiful white crimson snowflake. So, you know, I'm an artist and photographer.
You are. I can tell everything is just so glorious and beautiful, you know, the way you describe it. Like I remember sort of seeing, I didn't really see my bone marrow. I saw what they had put into the little, you know, cylinder, but definitely didn't see a shining seahorse or like a snowflake. So I appreciate you and your perspective. And we'll talk about
my
your
friends tell me
poetry
I'm very descriptive, so.
Right, and so I was just saying we're gonna definitely share your poetry later because that, you know, is part of you, and I love it. So sorry, I can't stop thinking about seahorses and snowflakes now. This is a first. I've never ever heard that, but I love it. I really do. I think it highlights your perspective, right? Like you're able to see beauty in things maybe where other people aren't. So that's wonderful.
Yeah, I'm kind of a tree hugger and an ocean hugger. So.
Well, I love, that's great. That's wonderful. We need more of those. So that's wonderful. You explained that. Thank you. And you did do this before your chemo, which you said began November of 2018. So,
yes.
And I know you were going into it like, all right, let's do this, right? Because it had been 6 years of just sort of waiting.
Yes.
So can you describe when your oncologist, how did she describe to you what that chemo regimen would be, the drugs and how long for each drug?
Well, that was the first doctor. That was Elaine Majerus. And she said I would typically need probably 6 months. I would have 25 days off in between treatments, and it would be 3 days of treatments. The first 2 days would be bendamustine, which would take an hour, hour and a half to go in my body. And then the last day would be rituximab, and they estimated that as an 8-hour drip, at least. Probably an 8-hour drip at least.
Gotcha. Yeah.
So.
And I know, Sheree, that it turned out very differently for you because there was an allergic reaction to the rituximab. So, yeah, can you describe that, sort of summarize what happened there?
Okay, do you want me to go into what happened at the facility or at home or both?
Yeah, both.
Okay, at the facility, so they would start with a certain milligram and they would keep increasing it. And each time they would get to the next milligram level, I would have some sort of reaction. So the first 3 months, the reactions ran the gamut from headaches to I felt like my throat was closing up. I felt like I had the flu. One month they thought I was having a heart attack, so they hooked me up to an EKG. So each time I would have a reaction, they'd have to stop the IV drip and wait about 20 minutes at least, and then give me a Benadryl, and then restart the drip. Well, the first 3 months, I was only able to get probably 40 to 50% of the rituximab in my body. And the very first month at home, about the second day after the chemo treatments, it was a living hell, to be honest with you. It started about, I don't know, in the evening when I started throwing up and nausea, really bad headaches. I felt like I couldn't get my breath. I felt like I couldn't get enough water, liquid in my body. I was to the point where I was throwing up bile. My husband urged me to call the nurse. I called the nurse. He had been to Target about 6 different times to try and get me different things to take, at the urgence of the nurse, because I didn't have any Benadryl in the house. So he went and got Benadryl. He got me like probiotics and yogurt and stuff that I could try and actually keep down, like the brat diet when you have a sick kid. And then it all started again. I took a partial Ativan and I slept for a couple hours. I got up and took a bath. And then it started again. And it went on till about 3 in the morning. I was calling the exchange again, and they were advising me what to do. There was this throat thing to make, it makes your throat moist. I can't think of the name of it, but so here he was the next day going back to Target, getting all of these things for me. I think I called the nurse 6 times in less than 24 hours. And by that point, I was so anxious and wigged out because of the reactions from the chemo that they advised I take another Ativan. Well, I took a full Ativan and I think I slept like the rest of the day. And then I got up to eat dinner. I was able to keep like some applesauce and some probiotic down, but my tastes were changing because nothing tasted good to me. I would drink like a soda and it would make me throw up. I guess it was the sugar, but it was just really one of the hardest times in my life was that first weekend.
Yeah, no, it sounds awful. It sounds like you went through everything that you could possibly go through. But so did it get better just after the basically maybe the toxins were flushed out and or because you were at home for 25 days, right? Or
Right, yeah. By about the 4th or 5th day of the first treatment afterwards, the nausea started to go away. So that was a good thing. By about the 10th day, I got my taste back. I remember going out of the house. They tell you really not to go anywhere for probably about the first 4 days after treatment because you're immunocompromised. I remember one time we were driving around looking for food to eat because I couldn't make up my mind. And I think I told my husband, oh, that sounds good. No. And then 5 minutes later, I would change my mind. And he's like, oh my God, woman, what are you doing? So literally, I was driving him crazy because I think I wanted something to eat, but then literally in a few minutes, I would change my mind. And
right.
it was really hard to plan meals around me
Yeah.
because
You should have just had a
I
buffet.
never knew what I wanted until the last minute.
Right.
And the really sad thing is I lost my taste for coffee for the first 2 months. And I actually am writing a poetry book about coffee, but it was really sad because nothing, it was just, even the smell of it made me sick.
Right.
So
Right. It sounds small maybe to some people, but these are day-to-day quality of life things that really plague you because you're dealing with it over and over again. And correct me if I'm wrong, but it sounds like there's also sort of like a sense of frustration because you love coffee and that's part of your identity. And here you are just sort of like repulsed by it. And it just maybe showed how much change was happening because of the drugs.
Yeah. Yeah. And may I say something, a good thing that happened?
Absolutely.
A good thing that happened was, well, when you're sick, your body knows it and your body rejects certain foods. And my body rejected junk food. I mean, literally, I would get sick. I would get stomach cramps, or I would vomit. And that's a good thing because I started eating better. I mean, the meals that we had when we cooked were healthy meals. And to this day, I still try to cook that. And I used to have this love for Fritos. They actually just turn my stomach now. I could literally eat a whole bag of Fritos in one sitting. And it's, Fritos are like nothing but grease and oil. Oh, sorry, Frito people. But, so I don't want that. And to this day, I hate sugary drinks. No sodas, no sugary juices, no sugary lemonades.
Right.
Even coffee syrups. I mean, just very minimal, like the most minimal amount of syrup in a flavored coffee. But I don't drink any of that. So I haven't for probably 2 years. It's mainly water for me.
Yep.
Teas, herbal teas, black teas, and then small amounts of coffee, coffee.
Well, we'll wait for your book about coffee and the changing relationship you had with it. I love that though. You had, rarely do we hear the positive sort of, side effects, if you will. So I'm really happy to hear that actually left some positive, impact for you.
I love red beets now. My mom used to feed me red beets when I was a little girl, like nonstop.
Yeah.
And I got so sick of them. But the minute I went through chemo, I just had this weird craving for red beets again.
Nostalgic.
So, yeah.
That's amazing. Okay, so red beets and coffee. Is that the title of the book? Or that'd be amazing. That'd be a great band name, actually.
Yeah.
Okay, so what you described, the allergic reaction, I mean, that happened for 3 cycles, right? Over 3 months.
Yes.
Because they were continuing to up the dosage, give you a break, try to give you Benadryl, but none of it was helping. So Sheree, did you say, or did the doctor say, maybe you should go somewhere else? I mean, what was the catalyst for that?
Well, Dr. Majerus actually, we had a meeting. She tried to do a rituximab session alone by itself, like within 2 weeks after the 3rd one. That did not work either. So she said, I'm referring you to Dr. Neha Mehta Shah. She said she is a lymphoma, like goddess or whatever, and she has done work at, I think she did a residency at Sloan Kettering. So when I got turned over to her, I met her team. Her nurses were her nurse practitioner, Jennifer, and then her nurse, Becky. And Becky is the one that figured out a spreadsheet to get this rituximab in my body, where they would go slow and then they'd take it up, but then the next level they would bring down. So I was up and down all day. And the first time in literally 4 months, I got out of my treatment in 6.5 hours. Wow. I did have a little reaction at the end, which was kind of like a sniffles or the flu. That was the last hour, and they gave me Benadryl, and I mean, it was
wow, relief.
And the nurses down at it did that at BJC downtown, so that changed also. I did my long days downtown after that.
Okay, and when you talk about this, for people unfamiliar with that area and that healthcare system, you're saying it's one system, they have different locations. There's one that's bigger. Is the downtown one the one you called the
Oh
bar?
yeah, BJC is a Center for Advanced Medicine. It's the Siteman Cancer Center in downtown St. Louis,
Okay,
off of Kings Highway.
I gotcha. And I ask you because we did sort of, sometimes we ask about, when you have a choice, the differences, the pros and the cons between going to a larger center versus a smaller one. You were saying the downtown one did have more patients at any given time, right? Do you have any advice to people,
Well,
I guess, on that?
well, I did some of my treatments at the West County and St. Peter's location, like the short days. They did not see that many patients. But the downtown location, this is all they do all day long. I mean, there's different, they call them chemo treatment pods. And the hallway that I was on must have had, I'm thinking, I don't know, maybe 8 treatment pods. And you go into a pod, there's only normally 6 people in the room with you, or five or 6 people in the room with you. And these nurses, this is what they do all day long from the time they get up till the facility closes, usually at 8:30 or 9 o'clock at night. So they are there for the long haul. And you have your morning nurses, and then you have your afternoon shift that comes on. And let me tell you, these are some of the nicest nurses I've ever met in my life. And um, they're just amazing. They're amazing. Yeah.
That's great. By
Yeah.
the way, I totally echo what you're saying. Nurses are such a lifeline, and they are they make a world of difference, really, right? Because they're with you through the infusion.
Right.
So yeah,
Oh,
I grateful for them for sure.
I have one thing I forgot to mention.
Yeah, please.
Anybody going through chemo, back to coffee again, do not drink coffee before you get the IV in your arm if you're not doing a port. Because what it does is dehydrate your veins, and then they stick you. Literally, one time, it was like 3 times before they could get it in. And the nurse said, no coffee before chemo. So I'm like, I wish you would have told me that like 3 months ago, because then I would have to go through all this stuff.
Actually, you brought up something I was going to ask you, so thank you, Sheree. So you
Yeah,
did go IV each time. You didn't get a port or a pick line.
that's correct. The port probably would have given me anxiety, since I knew it was only going to be 6 months of treatments. This thing sticking out of my chest, I wouldn't have been able to sleep. So I chose to go with being stuck each month.
Okay,
Yeah.
great. And so your advice to people there is don't drink coffee, make sure you're well hydrated, right? That's pretty
Oh
much
yeah, you
covers it.
need to be well hydrated before they thread that IV in your arm.
Yes, yes.
Yeah.
Okay, thank you for
And
that.
then the minute that it was threaded in the arm, I sent my husband for coffee down the streets.
So yeah, you just have to hold off for a little bit, right? And then you get it after. Very smart. Um, so then you had your remaining 3 cycles with the new doctor, is that right?
Dr.
And
Muhammad, yeah.
yeah, and so this time they would adjust the dose differently. They would go like from this number to higher, but then to like a medium number, and that worked for your body.
Yeah, they went up and down with the rituximab. Yeah, and my what do you call it? Symptoms at home were different then.
Yeah, your side effects.
hmm
Could you what were the different side effects at that point?
Basically, I slept. I just became tired. I had no other problems with anything. Maybe a little nausea, but I was just tired. And the day of treatment, I would go to bed when I got home, and the next day I slept, and I usually slept great periods of time for at least 2 days after, and then I woke up and I felt like a new person. Um,
Great.
my sense of taste got shortened, um, and like I said, the nausea only stuck with me usually a couple days instead of five 5 days.
Okay, that's wonderful. So you were able to
Yeah.
finish out strongly. Can you describe, so as you're going through treatment, were they just monitoring the blood test, the protein levels? Were they also scanning you? And how could they tell at the end, like, okay, Sheree, you're done with chemo?
Um, well, they were monitoring all of my levels, but the IgM protein was the main one that they needed to get into check. But they did like a CBC, and I'm not even sure what the tests were called, but yeah. So as soon as they saw those numbers get in the normal range, that was it for me. But the doctors know. I mean, they know that it normally takes about 6 cycles of treatment. I don't know how they know. They're just so experienced at it. And then we were done.
Yeah.
Yeah.
Wow. So at the end of your last cycle, was it anticlimactic? Was it like, oh my gosh, I'm done, I'm free? What was it like for you?
Well, I actually got to ring the bell twice. So I rang the bell the night of my last treatment at downtown St. Louis, and the nurses presented me with a certificate, very sweet, that I had gone through chemo treatment and I survived, and they gave me a survivor keychain, and we all took a picture together. And on the 7th floor, there was no one in the waiting area, and it was my husband and I, and he videotaped me ringing the bell, and I did a little goofy dance. And so that was the first time I rang the bell. Now, the second time I rang the bell was when I went for my checkup, which was in June, beginning of June, at the doctor's office at the West County location. And she said, I just want to tell you, you're in remission. And I literally started crying. And it was different than ringing the bell when you finish treatment, because you really don't know what your numbers are going to be like, or what's going to happen over the next couple months. Are you going to be in range? Or so I went out in the lobby and I asked Becky, I go, I don't know if I should ring the bell. I already rang it after my treatment ended in April. She's like, girl, you go ring that bell. So I went out in the lobby and rang the bell, and everybody in the waiting room clapped for me. And I got emotional again. Probably more emotional than the first time, like I said, because it was still an unknown. And I started crying and I walked out. And it felt different because someone tells you you're in remission. It felt good. So, and I'm like, well, what does that mean exactly? And she's like, well, the lymphoma's gone. I'm like, what? So she said, we still have to monitor you, and you'll be getting quarterly checkups.
Yeah. Wow, that's amazing. But you're right. I mean, it's the moment when they actually say, hey, the lymphoma's not there. Not just when you end treatment, but when you actually get that sort of confirmation, that's
Right.
that's when a lot of people feel liberated. So
Yeah.
so then you mentioned the follow-ups, Sheree, and are you still going to the oncologist and doing blood work every 3 months, or did COVID sort of throw that off?
Yes, I just had a checkup 2 weeks ago. We're all masked up, of course, and I had my CT like the week before, and that was normal. And yeah, my numbers are starting to climb a little bit. But they said it's no concern. I believe my IgM level is at 472, and normal is 250. But like I said, they don't really get concerned until you hit like the 2000 range for some reason.
Okay.
So I'm thinking it took 1 year for it to climb 200 points. So maybe I've got another 10 years before I have to do chemo again. Hopefully I don't have to ever do it, but
Right.
it's not something that you can just say, no, I'm not ever going to have chemo again, because you may.
Right. Actually,
Yeah.
I'm glad you're bringing this up, Sheree. you know, dealing with an aggressive form of cancer versus an indolent one, I mean, they're very different experiences in some ways. So for you, like, how do you think of it? Is it more like, well, this is sort of like a silent chronic disease that just sort of might be there, hopefully isn't there? I mean, how, I guess the question is for other people who maybe are just starting their journey with an indolent growing cancer, what's your
Mhm.
guidance?
Um, I would just say, you know, be open to what the doctors say to you. And if you don't jive with your doctor, get a new doctor. Um, you know, for me, I researched the best hematologist in St. Louis, and why not go to one of the best ones? You don't have to go to a doctor that your doctor, your primary recommends if you don't want to, if that's not what you feel in your heart is right. So you go to the best doctor for you in that field. I mean, we have two other friends, my husband and I, and we were all three of us, my friend Dave and Rick, all diagnosed with um, cancer lymphoma within a couple weeks of each other in yes, 2012. And I I mean I think that our one friend Dave is a walking miracle, and our other friend Rick had lymphoma twice, and he's been in remission. And they found the best doctors for them. Don't just settle for, don't just settle. I mean, it's your life we're talking about. You do what you want, you go to who you want. If they don't jive with you, go to somebody else. I mean, that's a big part of being comfortable and hopeful in your journey. That doctor team.
Right. It's
Yeah.
important that you, as you said, jive with them and you're relying on them. So it's a big part of your life. That's great advice. You know, as we move now into sort of this section about quality of life, um, for you, I do want to ask about support and caregivers. So if I'm hearing it right, your husband was your primary caregiver,
Yes.
and what was it that you needed the most support with? And outside of your husband, I think sometimes patients find it difficult to ask for help from other people if they need it. I don't know if you needed help from other people outside of your husband, but do you have any advice there, right, in terms of
Um,
support?
I, for me, my biggest thing when I'm going through a health concern is that I want nurturing and compassion. That's me. Now, someone else may be totally different. And my husband was with me through chemo, and I had three of my best friends would sit with me as well. And that's really important, you know, and that would give him a break if he was kind of getting to the point where he needed to do some work or, um, you know, stressed out with just my issues because the spouses, I think, kind of go through stuff too. Um, but yeah, just for me, it was nurturing and compassion and that conversation, the friendship, the, you know, the hubby being there and just knowing that you can count on them to be with you.
Right. Absolutely. And you know, you talk about sort of the emotions of this all, and you know, for you with the mental health aspect, what helped get you through sort of the hardest times? And then did you have to seek some help with that also even after treatment, right? Where a lot of us do our healing after it's done.
Um, well, I did rely on my friends a lot to talk. Like if I just want to have a good cry, I'd give them a call and we'd talk for a long time and visit. My faith helped me get through um, the journey, and um, you know, my husband was there for me along the journey. And even though I probably drove him crazy because he was, like I said, went to Target 6 times, I think, in less than 4 hours. Um, but you know, I had contacted a counselor. I even went to talk to a counselor on my own, which was someone that we'd used before for something else, but I didn't get that compassion from him. And I think maybe it's more a woman thing. I think women feel comfortable talking with women about stuff like this. I did have anxiety. I mean, I typically had anxiety probably the first 3 or 4 days after chemo. And I don't know if it was from the chemo or if it was from the Ativan I was taking. Ativan's supposed to help you, but then sometimes if you're coming off of it, you kind of get kind of jittery. So I made sure the last 3 months, I weaned myself down to literally a quarter of a pill if I needed something, and that might be twice a day for the first 3 or 4 days. But I prayed a lot. I got out. When I can walk in nature, like usually after probably about third or fourth day, I felt comfortable going to a park with the dogs. And I still do that to this day. Every morning I get up, I do my routine, breakfast routine, and take care of the animals. And the first thing we do is we get out the door and we get in the car and we go to the park and walk, because it's good for them and it's good for me, and it helps me get my head straight for the day.
Right.
Although now with this eye issue, that's another thing. I'm having trouble reading now with my other health concern. But
is that
so
separate from the Waldenstroms? The eye issue.
Pardon me?
The eye issue that you're dealing with is separate from the Waldenstroms.
It is, yes.
Okay.
Yeah, it's a macular hole in my left eye retina, and it's also like causing me issues where it's just really hard to work right now with this eye problem. So I just kind of resign myself to the fact that I'm not going to stress out about writing right now, probably for about the last month or so, because it makes it worse if I try to do something and I can't do it. So.
Right. And it almost ties back into what you'd mentioned earlier, Sheree, about the control thing, right? It's like in cancer, a lot of times we're having to learn to let go of a lot of things. And so hopefully that's one thing that will help as you navigate through this other health issue, which we're sending you as much positive vibes as possible.
Yes, I'll take those vibes.
My last question, Sheree, is just what's your message to people who are watching and reading this? I mean, a lot of people are both patients and caregivers dealing with maybe a new diagnosis or in treatment. You're on the other side, and I think that's inspiring for a lot of people.
Well, I would say if you're the person going through the cancer, for me, it was always just try and stay focused and listen to what the doctors are telling you. It's going to get bad at some point. You are going to go through storms, but those storms are going to be over with. And then you wait till the next storm happens and you just go through it. And I would say don't be afraid to take an Ativan if you have to. I mean, it sounds really, I don't take them now, but I probably could use some for my eye issue. But because it does help relieve with stress, and you don't want stress in your life. And I've been getting too stressed out lately with my other health concern, and but that also has to go back to I think the team of doctors that you have, because if they make you feel confident, then you're very hopeful. And praying helps. That's a good thing. And if you're the caregiver, realize that the patient's probably going to go crazy sometimes. as my husband has probably found out. Um, and just, I don't know. I think it's hard for them because they just don't know what you want. And one minute you want something and the next minute you might want something else. And they're trying to keep up with your requests. And I think it stresses them out as well.
Right.
But just a note for the caregivers, to be patient and compassionate and nurturing, and it helps the patient be calm.
Yeah,
So,
which helps everybody, right?
yeah,
Okay, thank you so much, Sheree. That was really beautifully said.
thank
I'm
you.
really excited to be able to get your story up. So everyone, be on the lookout for Sheree's story. It will be on thepatientstory.com in a little bit, and we'll let everyone know. But Sheree, thank you so much for joining us today. I really appreciate it, and so glad to see you, looking and doing so well and so good.
Thank you.